Good afternoon. Thank you very much for joining our April live stream. My name's Dr. Lazier. I'm the managing partner here at Whole Green Health. I'm really grateful to all colleagues who are able to join us. We've been very keen to keep this channel of communication open during these challenging times for all of us. This has proven to be really effective in terms of being able to answer some key questions that our patients at the practice and other colleagues and their families are worried about. The agenda for today's live stream, as always, is we are grateful to all those who responded to our poll and told us about things they're concerned about. We'll come to that, but I've also got some more colleagues from the wider team at Whole Green Health who are joining us to try and help us articulate some of the things we're doing at the practice, as well as some of the challenges we've got. It's only fair we share with you actually some of the things that we're having to go through to make sure we continue to deliver the best care we can for all of you. So in the live stream, we'll have our practice manager, John, who will join us, tell us about exactly how everything has been, what sort of activity and how busy things have been more recently and why. We've also got our patient services manager, Andy, who will be joining us. Andy will tell us about some of the things that she's come across in terms of the way we're offering our services to patients and the things that the concerns you've raised and what we're doing about them. We have Nikki and Louise, who are our reception team leads and leaders, and actually they will tell you about some of the challenges that the reception team are facing at the present moment in time. I'm also grateful to one of our call center agents, Lorraine, who will come on and tell us about actually some of the things that our patients are asking about, and actually the best ways you could probably contact the practice and what we can do for you. And then we'll move on to Dr. Abdul Razak, who will give a COVID update. That's one of the things that people have questions about usually, and tell you where we are in our both our COVID pandemic response and what's happening presently, as well as the vaccination program. And then finally, Dr. Anne Cartmill, who will tell us about the appointment system. And I know a lot of you are really keen to understand actually how things are working. You know, we continue to be open, we continue to see patients, but there is a different way of working presently just to protect both yourselves and the staff at the practice. But Dr. Cartmill will go into a bit more detail about actually how all of that's working. And then towards the end, we're going to move on to questions and answers. We'll cover the main questions we got on the polls, but then really keen for you to post your questions in the chat function so we can pick them up. Phoebe, our social media and communications manager, is online monitoring that, and she'll bring those questions to the front, and then I'll make sure one of the right members of the team respond. But thank you again for joining. I'm just going to double check if John has managed to join us, and we'll bring John in. Over to you, John.
Thank you, Dr. Lazier. And good afternoon, everyone, and thank you again for joining Whole Green Health's live stream today. I just wanted to talk a little bit about where we are at the moment as a practice, and obviously with restrictions easing, it's had quite a significant impact on the demand in terms of calls coming into the practice and requests for appointments, and it was just really to kindly plead for some understanding. It really when you're trying to get through on the phone and struggling somewhat. So to give you an example, compared to this time last year, we received 89% more calls. Now in terms of numbers, we're talking a few thousand more calls across the week than we would normally be used to having. Now, you know, talking in terms of our team, obviously it's very difficult for us to increase the size of our team at such short notice. This is unprecedented times and unprecedented levels of calls. So I just wanted to mention and just highlight just how difficult really it's been for us and our team recently, and just to plead for some understanding. If it does take some time to get through, please do bear with us. And I mean, and on that point, please only do contact us if it is absolutely necessary. Whole Green Health has obviously volunteered to become a local vaccination site for our COVID vaccinations, which is also having an impact. A lot of these patients are receiving text messages. The large majority are receiving text messages to book in electronically. And whilst we understand that not everyone is comfortable with doing this, it is also resulting in lots of calls from those patients calling in as well. And we're doing our best to try and signpost those patients to a different group of staff that are working just to deal with those sorts of queries. So when you do call, if you do get a text and you're not absolutely confident in booking your appointment through that method, if you do call through, there is an option to go through to a COVID call team, a call center, who will then, they will take the call from yourselves and book you in where you would like to be booked in. The other thing I wanted to touch on again, there are quite often misunderstandings that we are doing everything over the phone or via video, and that's simply not the case. So I just wanted to share some information with you around that as well. In the past 4 weeks, for example, our GPs and nurses and HCAs have seen approaching 3,000 patients in the last 4 weeks, 2,800 to be exact. So it's just to reiterate, our doors are open, and if you do need to be seen, that we will of course find a way to get you in and get you seen. So I just wanted to share that. So thank you for your time, and I will hand you back. And I'm not sure who is next. To Andy Jones. Andy, over to you.
Good afternoon, and thank you, John, for that. I'm Andy, the Patient Services Manager, and this afternoon I've just been asked to just go over a few things that we have been facing, as our previous speakers have said, at the practice. And this is the minute amount of patients. It's not all of you, and I would never put you all in that same category, but we do have the odd few patients. And in the last few weeks, I've been called a lot to either the front door at the practice to deal with patients that are very impatient, that want to be seen or demanding to be seen, you know, shouting at receptionists at the door. Now, this is something that we don't expect to be getting, and I know with the easing of the restrictions in COVID that everyone feels that the practice is open now and we can come up to the surgery just as we feel. Well, that's not the case. We still have to be safe, and it does have an impact on the receptionists that are dealing with the patients that are here for appointments. There are more and more queries come in to the front door, which I'm having to go out and deal with those queries, which is not a problem, but obviously it's taken up a lot more time. So we do have areas where you can contact us at the practice by using our website. Also, I've been called to telephone calls that the receptionists have been receiving, and not just the receptionists, but our paramedics, our GPs, of irate patients, or they may be angry. You know, they've waited 40 minutes on the line to get through, and then obviously they want to be dealt with. And that also isn't a problem as such, but I do feel that the attitude of people needs to change slightly in the way that we speak to each other. You know, there's a level of respect, there's a level of communicating with us so that we can get the best possible result and outcome. And one of those examples is that I had one of my paramedics who came to me and asked me to listen to the phone call. I listened to the call, which was a very difficult call that was put through. And, you know, it was, you're just the paramedic, you haven't got a clue what you're talking about. And, you know, and they're not just a paramedic, they are clinicians, they are expert in their area, their field, their knowledge and everything else, and they can help a lot more. And especially if they're giving you advice that you will need to go to the hospital, you will need to be seen in A&E. A paramedic is that person that would give that sound advice to you. And I think that we need to appreciate what we have got at the practice. And we have far more than many practices right now, in the sense that we have a lot more clinicians to help with triaging our patients. And that's my, you know, message to you, is that we would like you to work with us, work with the team that we have got. My responsibility, as I've said, is to make sure that we are putting the right message out to all our patients to ensure that you feel that you are being supported. But also I do have a duty of care to the staff that I work with to ensure that they feel that they're being supported also. So I just feel that this is an opportunity for us. And as I said, it's not, sort of like the majority of our patients, it's just a few in number, but those few in number can make a massive impact on the team. And I just wanted to plead with everyone, please just let us have a bit of respect for each other. If there are issues, please bring it to my attention, and my endeavour is to try my very best to get back to you all and to work with you for a smoother running of the conditions or whatever the problems are, and bring those to the attention of the appropriate clinicians. So thank you very much for listening this afternoon.
Good afternoon, everybody. I'm Louise, and I'm here with Nikki. We are the reception managers. Nikki will be speaking shortly. With reception being the hub of Hall Green Health, we wanted to take this opportunity to give you a brief insight of how things currently are in reception, and the impact that a demand has had on staff just over the last couple of months. As John mentioned previously, we've had an elevated level of calls, a 50% increase in our call volumes, and that's happened quite sharply. So the staff are putting in as everything they can currently to do what we can to support you, and the demand at times when other services elsewhere have been reduced. So I'm going to hand over to Nikki just now. Thank you.
Hello, thank you everyone. So obviously throughout this pandemic, we've understood and we do understand your individual struggles. However, we have to also focus on the staff members as well. They've found they've gone through the same struggles that everyone else has gone through. We're all human, and they've done this whilst being at work. And they've done this keeping the patient's needs at the heart of what they do. And this has been quite overwhelming when the demand hasn't been as we'd have liked it to have gone. We understand we've got, a mass number of patients at the practice, and we enjoy taking the calls, looking at the website requests, but what we don't enjoy, which the staff members have found very overwhelming, is the verbal abuse that we've been getting over the phone. At times, due to demand, myself and Louise will always help and support the team as much as possible by taking these calls, so you have a less waiting time, get to your problems a lot quicker. We find that even though we triage everything that we take on from yourselves, we've gone to a clinician, we've come back, and the demand from certain patients, our answer isn't good enough. We've had staff in tears. We've had staff have to walk out the room for 10 minutes. We've had name calling. We've had just an example, which I hate to mention, but I think it's appropriate to know what we're actually going through. We've had a patient tell one of our staff members on the front door that she's got a nappy on her face because they decided not to turn up with a face mask. This is what we are going through verbally, sometimes on a daily basis. I'm not going to say it's the majority of patients because it's not, but it's really not helping the staff. They want to enjoy their work. We all want to enjoy where we work. I'm sure everyone can appreciate that. But it was just really to let you know that we are very overwhelmed at the moment, but our job, which will always be our main focus, is keeping our patients happy, and that will continue. But we would just ask that if you can just bear with us, understand that we are human, the same as you, and our job is to do everything we can. But if that everything we can has come to a clinical decision, and that we can't really go any further with a certain issue, you're not happy with the decision, then it will be passed over to our patient services manager to take that on. But thank you for listening to us both. Thank you.
Thank you.
Hello, my name is Lorraine. I'm a receptionist at Hall Green Health. We are a very busy surgery and therefore we have a high volume of calls waiting to be answered on most days. Can we reassure you that we are doing our very best to help our patients during this difficult time, but you can help us to help you more efficiently by contacting the practice on www.hallgreenhealth.co.uk. It's a very helpful and informative website for those patients that have this facility, and it would help us by reducing the amount of calls coming into the surgery and allowing patients that don't have this facility to get through a little more easily without the stress and anxiety. Which leads me on, I think has been said by some of my colleagues, that please be patient and respectful when speaking to reception. If we're not able to resolve your query or problem that day, we will be able to tell you what we can do to help and when it may be resolved. Please remember, our patients' needs are always at the heart of everything we do. So contact the practice on www.hallgreenhealth.co.uk. Thank you very much for listening. Thank you.
Afternoon all. Welcome everyone to our Facebook live stream. Those of you who don't know me, I'm Dr. Abdul Razak. I'm one of the partners at the practice and also COVID lead and spearheading the COVID vaccination process at the practice. Just a quick update. To date, we have delivered 16,250 vaccinations, and we've done very well in our first 9 top cohorts, and that is the above 50s. We're now starting operations on the under 50s. We have got clinics going on most weekends and sometimes Thursdays and Fridays as well. So the message out there is, you know, we are still governed tightly by the government guidance. We are approaching people according to their risk levels, so you do not need to contact us. We will be contacting you. Similarly, for the second doses, we're doing the same. So we will contact you when your time is up. Obviously, if you're coming up to your 11th week and you've not heard from us, it's probably worth dropping us a query via the website so we can look into that. But in all, it's going very well. Thank you.
Good afternoon, everybody, and thank you for joining us this afternoon. I've been given the opportunity to talk to you about our appointments, and you, having listened to my colleagues speaking, you'll be aware that there's a bit of a theme emerging. It's really fantastic that the pandemic appears to be easing and that in our country things are changing and appear to be moving forward. And as a practice, we are also obviously aware of that and are attempting to move forward as well. Before I come on specifically to the appointments, what I'd like to remind people is that before the pandemic, we had spoken to you in our coffee mornings and in our live streams about the national shortage of GPs and how we as a practice at Hall Green Health were trying to mitigate for that and try and ensure we could still provide you with the very best service possible. And one of the ways that we've done that is pre-pandemic and even through the pandemic we've been looking at how to expand our workforce so that we're in a position to offer you, our patients, the very best service possible. Now, that has meant that in order to compensate for the shortage of GPs nationally, we have looked at expanding our team and have been really successful in doing so. We've appointed physicians associates, we have advanced nurse practitioners, we have paramedics on our team, That's in addition to our clinical nurse specialists, our practice nurses, our healthcare assistants. And we spoke in our last Facebook Live event about recruiting our mental health practitioners. We also have a first contact physiotherapist who joined us a few months ago. And of course, we have our clinical pharmacists who have been involved in helping us in terms of our prescribing and ensuring that you're safe. So we have a real, really big, diverse team at Hall Green Health. And one of the things that we've asked you to do pre-pandemic and through the pandemic is to let us know a little bit about why you want to be seen. The reason that we ask that is so that we can ensure that to the very best of our ability, you get seen by the right person who can deal with your problem promptly and efficiently. Now, yes, in the old days, the only person that you would see was your GP. But things have changed over the last 10 to 15 years. We've moved with the times. And those of you who have seen the other members of our team will know what a fantastic service they're all able to give. In fact, even pre-pandemic, lots of patients who saw our advanced nurse practitioners or our paramedics didn't realise they were not GPs because they weren't in uniform. And in fact, for our clinical nurse specialists, it's only the fact that they are there in uniform that enables you to distinguish that they are nurses and not doctors, because what the service that you get from them in terms of the appropriate management of your chronic disease is potentially even better than we as doctors would be able to deliver, because we are maintaining our awareness of how to manage lots and lots of different conditions, and our clinical nurse specialists are looking at a finite area where they have become incredibly experienced in helping patients deal with their condition that they're suffering from. So we have a big team, and the reason that we ask you to submit a request via the website or ask you questions on the phone through our receptionists and care navigators is so that we understand what the problem is as best we can, and are then able to direct you appropriately to the right person to sort out your problem, rather than you needing to see several different people before your problem is resolved. So that's how we work here. And I come back to what the other members of the team have said in this live stream. We are, as an organisation, trying all the time to put our patients at the heart of what we do. And that means we are constantly striving to offer you the very best service that we can. So in that respect, in terms of appointments, of course, we're looking at how we can move forward, what appointments we can open up now that the pandemic appears to be relaxing. What I would say is there are some services that we had stopped and suspended during the pandemic. Things like cryotherapy and minor surgery are probably the two remaining things that actually we haven't yet opened up to our patients. Everything else, as soon as we've been able to, we've gradually opened them up and reintroduced them. Because shielding has ended now, we're going to be looking at how we utilise our Shirley Road site. We're no longer going to be protecting that purely for those at high risk. And we're going to look at how we then move forward and develop our services, bearing in mind that we are still offering COVID vaccinations at our Hall Green Health site. So we need to look at how we open up safely and how we structure our services to provide what we want to deliver for you, our patients. Please remember, your safety always is our priority, but we also want to be considering the safety of our staff. So at the moment, we are still going to be asking that people who come will wear a face covering. People who come are prepared to check their temperature and accept that if they appear to have a fever, that we are going to turn them away, because that is for the safety of all of the people coming in to the building. We want to make sure it is as safe as possible. So we want you to continue to help us. We've been so impressed with the response initially during lockdown. When the pandemic hit and we asked our patients to contact us only if it was really urgent, you did that, and that helped us manage those who were really unwell at the beginning of the pandemic. As things changed, we asked you to try to use the other services that were open to you. So using the resources on the government website to help you manage your condition, speaking to the minor eye condition service or referring yourself through to that if it was a minor eye problem, contacting a dentist if it appeared to be a dental problem, and speaking to the community pharmacists for those problems where they might be able to help you with minor ailments and so on. And you did that, and that really helped us manage demand through the difficult stages of the various stages of lockdown in the pandemic. We are coming out of that now, but to continue to help us to manage and be available for those most in need, then we would ask you to continue to think about doing those things. It's likely that if you put a request through for an appointment where we feel that you will be better served by our colleagues elsewhere, that you'll be directed to contact those services. That's not because we can't do it or shouldn't do it or aren't interested in doing it. It is simply that those services have been set up to free up general practice for dealing with the things that only we can deal with. And the more that you can support us by seeing our colleagues in the community where appropriate, but also letting us know what the problem is. Because if you can go online and give us the information in the online form, that is fantastic, because that allows us to a clinician to read through the form and ensure that you get what you need. And that is in terms of whether it's urgent for today, urgent within the next 2 or 3 days, routine, or better followed up with a clinician who already has seen you about the problem and knows all about it, so you don't have to start at the beginning and go through it all again. That's really helpful to us, and it's going to be helpful for you because you get to the right person at the right sort of within the right sort of time frame. For those who can't use the technology, don't worry. That's where we want you to contact us via the telephone. And if all of those who can use the online forms do so, that frees up our receptionists and healthcare navigators and call centre staff who are taking those calls to more effectively deal with your request. They'll ask you for the information. Please give them as much as you feel comfortable telling them, because they will then take that to a clinician who will review that in conjunction with your clinical record and will then decide from a clinical perspective what it is that you need. Now, sometimes what you want is not necessarily what you need. And that's where we would ask you to accept that your request has been based on the information that you've given to us. So the more honest you are, the more open you are, the more likely we are to be able to do what you need first time round. So I hope that's answered what we're doing in terms of appointments and how we are still trying our very best, as we always have done, to be there and to meet your needs as quickly and efficiently and as safely as we possibly can. Thank you, everybody.
And thank you, Dr. Carmel, and thank you to everybody else and the rest of the team who sort of come on and been able to share with you. And I did want the team to share with you, honestly, the experiences that they had. You know, they remain committed, as always, as it's been highlighted, to look after you. And actually, that's at Horgan Health, that remains our key mission, is to place the patients at the heart of everything we do. We are here and we do this job because we want to look after you. But we do need your help with this. And just building on a couple of points from the presentations, before I go to the questions in the poll, we have had we do a regular staff survey of the practice, and the most recent survey, for me as a managing partner here, has been worrying, because actually for once, what I'm seeing as common messages in the survey is the amount of stress and anxiety and upset in the staff, and especially the reception team, the frontline team, because and as a result of that, we have had people leave, which is unfortunate, because as much as we want to try and answer the phones and respond to the website queries quickly, we haven't got the team in place it's difficult for us to do. So, we do need your help. We do need you to be kind, to each other, but we also need you to be kind to us, because actually we remain committed to being kind to you and looking after you, making sure we can do everything. But we do need your help. And yes, we could bring in more staff with more demand, but it takes a lot of experience and training to get people to a point where they can actually be able to deal with you and make sure that you're dealt with safely. Just to highlight that, actually, for me, I'm looking at ways in which I can make sure we don't lose any more staff and we continue to look after their well-being. If I go to the questions that we had from the poll first, I'm going to pick up the first question, and then I'll move on to colleagues to help me answer the other ones. New patient registration. We've got new patients joining from practices near us, and even some patients who hadn't registered with a GP at all, but have been living on the patch for a long time, and they're asking, can I get a general checkup? And yes, there are bits about a general checkup. We're trying to move back towards that. At the moment, we are trying to prioritise some of our patients with more higher risk, with those conditions like diabetes, heart disease, other checkups they need. We are doing that, but please put in a request. And actually, we are switching towards getting back to where we can hopefully do some more general checkups. If you've got a particular condition and you're overdue a checkup, then absolutely, if we haven't contacted you, get in touch, and we can organise that for you. But as part of the new patient registration process, what we do is go through the patient, what patient declares, what age they are, and actually identify the patients who do need a checkup. And we do try and get them in. If you're on medications, we try and get our clinical pharmacy team to have a look at your medications to make sure that you're on the right medications and you've had a checkup for those medications recently. That's a fairly standard part of our process. But if you have got any queries about that, please go onto our website and contact us. Let us know that's what you're after, and we'll make sure the right member of the team contacts you. And just one last thing about the reason you get asked the questions at by the reception team on the phone or on the website. Historically, as Dr. Cartmel said, patients would see a doctor, and then I would send you on to see a physiotherapist or a mental health practitioner, or book in with a nurse for a blood test. A lot of these things we can do from the outset, so it would save a lot of time. And actually, what I'm really keen is that the GP appointments are kept for the patients who've got complex needs, and actually we can spend more time with them. And actually, what you don't do is, if your pain is related to muscular, that you get to see the physiotherapist first, who may be the expert in the area. But information you give us allows us to do that. If we manage it that way around, then actually we can make the best use of the team we've got at the moment, rather than a person having to have several appointments before they get their issue resolved. So really keen, and as the team have said, please try and help us with that information, because that really goes a fair way towards us making a good assessment of what you need, and then making sure you get that. I'm going to pass on to Dr. Cartmel just to talk about the repeat dispensing system. Dr. Cartmel.
Thank you. Hello again, everyone. One of the things that we did at the start of lockdown, when the pandemic hit, was that for a lot of patients on regular medications, and particularly all of those who were shielding, is we did switch to electronic repeat dispensing. For those of you that don't know, this is where you're on regular medication, we can send the electronic prescription through to the pharmacist for a number of months, where it is safe to do so, and the pharmacist is then able to dispense without you requesting your prescription in the interim. Now, clearly, this is a great advance, but there are restrictions to it. And one of the things that our clinical pharmacists have been doing during the lockdown is looking at setting this process up properly, so that we're able to expand it to all of those where it would be useful. And this is where individuals are on set medication, where there's unlikely to be any changes, and where they're not on any controlled drugs. And so our pharmacy team have done a piece of work where they have identified those who are suitable for electronic repeat dispensing, and we're looking at rolling that program out going forward. So what I would suggest is, if some of you will have been on electronic repeat dispensing, and it's going to be appropriate for that to be continued. For others of you, if you're on controlled drugs and so on, we may have initiated it as part of our wanting to keep you safe during the pandemic, but it may well be that we need to do something slightly different going forward. So if you've got any questions around electronic repeat dispensing, or your prescription's not been ready, then please do get in touch with the practice, and that your query can be passed through to the pharmacy team, who'll then be able to look into it, assess it, and make sure if you are suitable for ongoing electronic repeat dispensing, that is in place, and you then don't have the issues going forward. And if not, then they will be able to explain why there are issues and work with you to determine how best to help and support you in terms of your repeat prescription management. So hopefully that explains that element. But our pharmacy team, we've expanded our pharmacy team, we're delighted to say, and they will be in a great position to be able to help you with your queries in relation to that. Thank you.
I'm going to hand over to Dr. Abdulrazak for the question on COVID antibodies.
Okay, this is a bit of a tricky question because obviously I think to put it simply, in primary care, we do not have the means to be able to test for antibodies either from a natural COVID infection or from the vaccination for our patient population. So I think obviously with patients who have got very severely low or no immunity, it is something that they need to discuss with their specialists. But in primary care, unfortunately, no, there's no easy means of us to test whether or not you've responded to the initial infection or to the vaccination.
So thank you, Dr. Abdulrazak. That's great. So we're going to move on to our questions and answer section. So I'm going to ask Phoebe to, hopefully what she'll do, she'll bring forward some questions we've got, show them on here, and I'll either I'll respond to them or I'll get one of the or bring in one of the team. Nigel, can Horgan Health keep us updated when you open things back up? Nigel, it's probably, I'm going to put that into context because we've never really closed anything down at all. We've had to limit some of the activity, and Nigel, and that's mainly to protect patients. And that was a government guidance, by the way, as well, that actually we should limit the activity that's carried out face to face to protect people. But yes, I mean the whole point of these live streams is to keep you updated on what's happening at the practice. But also, I'm really keen, Nigel, going forward. Some patients have already told us they actually enjoy the experience of having a virtual appointment. So we'd like to offer choice to our patients. Okay, and there'll be some patients who would be more than happy to continue having virtual appointments, telephone or video, and others who would like to be seen face to face. And I'd like you to help us work out actually what works for you. Because actually different people have different preferences. But yes, the aim is to keep up these regular live streams and use social media to keep you updated on what's happening at Horgan Health. Next question. Dr. Abdulrazak, please.
Thank you, Shifa. Pfizer vaccinations. We do offer Pfizer vaccinations. The majority of the first doses Pfizer vaccinations were for our first high-risk cohorts. These are the ones that we did in December and January this year. So the bulk majority of the vaccinations that we have got in stock is the AstraZeneca vaccines for the first doses. We have got Pfizer vaccinations coming in for second doses for those people who had their first doses earlier this year. Thank you, Nigel. Do any of the vaccinations, I take it, cause blood clots? So obviously this pertains to the news coverage about the AstraZeneca and Oxford vaccine having caused a specific rare blood clot called, cavernous sinus thrombosis. This is slightly different. So these blood clots that have been linked to the AstraZeneca vaccine seems to be a particular type of blood clot. They seem to happen more if you have clotting disorders. So the government had made the decision, having gone through all their data, working with our European colleagues, to say that the benefits still outweigh the risks in terms of having the AstraZeneca for the majority of us. They've had to do a balanced decision for those under 30 years old, because obviously the youngsters, when they do catch COVID, they seem to not be as badly affected as the older population. So the recommendation that came out recently was to say that AstraZeneca is still beneficial for most patients above 30. So patients who are under 30, we are trying to offer them an alternative vaccination. To put these clots into context, Nigel, the lots of other conditions, things like, they've said that the risks of clots are comparable to people being put on the pill. Pregnancy itself has got clot risk. Long haul travel has got clot risk. So, obviously when we read about clot risks in the papers, they do not differentiate these different types. So we do know the blood clots that happens. These are rare blood clots. They are different type blood clot, and they seem to affect people of a particular risk group. So these are people with clotting disorders. So obviously we are telling our patients, you're fit, healthy and well, and you're above 30. The bulk majority of you, the benefits of you having the AstraZeneca vaccine still far outweigh the risks. Obviously, if you've got any particular medical condition, then this will lead to a specific one-to-one discussion with your GP or your consultant to see whether or not you would be best given an alternative vaccine. Obviously, by delaying the vaccine, if you're healthy and well, puts you at risk of getting the COVID infection. And do not forget that 1/5 of our COVID sufferers end up getting blood clots. So it's a difficult one. So it's a fine risk-benefit balance. So if you've got any medical conditions that would predispose you to a clot, we'll have a conversation with you. If you are above 30, fit, healthy and well, AstraZeneca vaccine is still beneficial for you. And if you're under 30, we will be thinking about offering you a different alternative. Thank you, Sabir. Is the vaccination card required for attending the second vaccine? No. Is the vaccination card required? Full stop. Not really. Most patients want it because they want it as a proof. All the information is captured digitally on a national database. So even if you've lost your first, your card that was done on the first, if you want that to be filled, we can fill your first and second dose. If you don't want your card, it doesn't matter. Yes, okay. Thank you, Rami Stephen. You had full side effects after your first jab. Will you still get them after your second one? It is variable because some people who've had the full side effects after the first jab go on to not having any side effects whatsoever. Conversely, some people who've been fine with their first jab we've had reports of the side effects in the second jab. We do know, and we've observed that a lot of the side effects are quite self-limiting, not long-lasting. And if we think that the side effects are minor and are able to be self-managed by patients, I would still recommend you come in. You still should come in to have your second vaccine, but we can't guarantee that. The problem with this is, it's not a fixed thing. Different people's immune response are different. The way you react to vaccinations are different. So I can't guarantee that you will or you will not get the side effects. But what I would probably say is, if the side effects lasted less than a week, definitely do come in, because the benefits of you completing your course far outweighs the side effects risk.
Okay, thank you, Dr. Al-Razak. I knew that many of the questions would be about the COVID vaccine. We're getting a lot of that on the phones here. There are still some really clear guidance and information on the government websites about this. But again, if you've got a query, we're more than happy to receive it if you send it via the website. But I'm hoping that actually what Dr. Abdul-Razak has just shared with you answers a lot of the most common questions that we tend to get. On that note, I think that's a lot of the questions we've had. So we do always try and send out a poll ahead of this. As I said, and as Nigel asked at the beginning, we try and do this because it's a really effective way of being able to tell you about the things that are going on at the practice. And I'm keen that as we go on with more of these live streams, we bring more and more members of the team on, just so you get to know them. Actually, one of the things is getting to know what services we offer. And we do, compared to a lot of other places, offer a wide range of expertise, okay, in terms of the different clinicians who actually can look after you, which means you don't have to travel anywhere else to get your care. Actually, that's one of the nice things about being a patient of Whole Grain Health, is that actually a lot of the things get done here rather than having to be done in a different location. And a lot of our patients are grateful for that, for that reason. And we're lucky, very lucky enough to be able to offer that. I'm going to close on the basis of a couple of things. One is please bear with us. You know, it is busy for all of us. At the same time, we're still going through and hopefully coming out of a very challenging year. Okay, and you know, and it will have almost certainly had an impact on all of us. It's not been easy. You know, as much as I look at our staff and, you know, people saying working from home remotely, you know, all sorts of things. Working from home sounds like a great thing at the beginning until you realize all the stresses and pressures of it. It's not easy. And the same thing here, you know, we've had to work hard to make sure our staff don't become unwell and the surgery gets to such a state where we can't run the service. And it's not been easy. So for all of us, and the same as with many of you, you'll have had the same pressures with family, friends, people being unwell, things you can't do. And I'm hoping that you're getting back to some levels where you can do things again, which actually cause you to smile and be happy, because actually it has been a difficult time. So work with us, please, and tell us the things we could do better to and improve for you. We're always willing to listen, and that is the main remit of Andy's job. You know, is to look at actually things we could do to make things better for you. Equally, tell us about things we should be able to communicate out to you, things that aren't clear about things we offer. And actually, what part of Phoebe's job as our social media and communications manager is, how can we tell you more about the things we're doing here? Equally, we'll reach out to you when we're struggling and we're under pressure, just to say, actually, we need to get the urgent things sorted first. So please bear with us. When we don't send those messages out lightly. So when we do flag that actually there's a huge amount of pressure because of some media coverage or some concerns, we do need you to bear with us, and we may have to focus on the urgent things first and postpone some of the more routine things until a day or two later. So please watch out for these messages. So we are trying to use all these channels to make sure you're always updated and know what's going on. I'm hoping, and I hope these live streams are working well, and please do feedback on these live streams, and we will continue to do these. But I also hope that sometime in the summer, when we're allowed to, that we're able to get together. I do miss our coffee mornings, and actually, you know, be whatever we had, you know, be tea, cake, fruit. Okay, it was a lovely time to get to see you all and get together. And I'm hoping as soon as we're allowed to, we will do that again. It's a commitment from myself and the partners. We're really keen, as much as you want to see us face to face, we would love to see you, you know, be it in informal settings, see you in that setting and be able to tell you about the things we're doing, answer some of your questions, but show you that actually how committed we remain to looking after you. On that note, I'm going to end with what I always say, which is be kind to yourselves, because actually just as important is we want you to remain well. Look after your family, look after your community, look after neighbours, you know, who are struggling and still may struggle with all the things that are going around them. And based on today, what you've heard, please be kind to our staff. I need to keep them here to be able to look after you effectively. And without them, I can't promise to provide a great service that we provide at the moment. So I do need them here, and we've had them for years. We've trained them so that they are focused on giving you the best attention and the best care you can get. But I do need your help to make sure we look after them as well. Please take care, and I look forward to seeing you at the next live stream. Thank you.